Hello guys and welcome back to my YouTube channel. Recently, sixth edition of this National Family Health Survey has been released by Ministry of Family and Health Welfare. So now let us look at some information about this survey and some key findings important for our exam. Now this National Family Health Survey it is released by Ministry of Family and Health Welfare. And this latest edition includes the data for the period of 2023 and 2024. And the nodal agency which helps in the conducting and this survey is International Institute for Population Sciences, that is IIPS Mumbai, and it covers the information about like population, health, nutrition, and about majorly about the women and children's like prenatal care, antenatal cares, and child stunting, wasting, data on obesity, and insurance coverage also is covered in this survey. So now look at some key findings of this year's report. First one is about the prenatal care and this maternal health. So 95.9% of the pregnant women receive the antenatal care. What is antenatal care? That is medical care or attention during the period of before birth of the child. So in the first trimester, it, antenatal care increased from 70% to 76.2%. Now institutional delivery it increased from 88.6% to 90.6%. Institutional deliveries means the childbirth is taking place in a institution like hospitals or nursing homes. Postnatal care for newborns by doctor, nurse, lady health visitors, auxiliary nurse, midwives, other health personnel within 2 days of delivery improve. That is postnatal care for the newborns has increased from 79.1% to 85.3%. Now, mothers consuming iron folic acid supplements for 100 days is increased from 44.1% to 54.9%. Now, this folic acid it is a very important supplement that has to be taken by pregnant ladies. Why? Because it meets the nutritional value and helps in the anemic conditions also in women. But it along with this, it helps in reducing the chances of severe anomalies and structural defects in the child after the birth. Like one of the major anomalies is spina bifida, which is a defect in the spinal cord related to spinal cord. So it is very important for mother's nutritional value as well as the proper child health. Now next one is you can see this data in the this chart form. Now moving on to the family planning improvements. So the India's total fertility rate it is found out to be 2.0%, which is below the replacement rate that is 2.1%. This is also a previous year question in UPSC exam that what is the total fertility rate? So it is the number of births that a woman give to, sorry, it is the number of child born to a lady during its reproductive age. Now, second point is that is contraceptive prevalence rate. It is increased from 66.7% to 69.1%. What is the CPR? It is the percentage of people using the contraceptives. Next is child immunization. Full vaccination coverage among the children aged between 12 to 23 months based on vaccination card increased from 83.8% to 87.1%. That is vaccination between child age of 12 to 23 months have been increasing, and 95.6% of the children received most of the vaccines through public health facilities, that is through the government organizations or hospitals. This is also a point that reflects the reinforcing of the public trust in the government healthcare services. Now, next one is progress in the child nutrition. That is child stunting, which is if the it is the condition in which the height of the children is lesser for its age. Now, stunting among the children under the 5 years of age declined from 35.5% to 29.3%. That is, stunting is reducing, which is a good indicator. Now, wasting, that is, weight is low for the age of the children, and it is also decreasing from 7.7%, it reduced to 5.2%. And underweight prevalence in under 5 years of age children also registered a marginal decline. It is from 32.1% to 31.8%. Next is children aged 6 to 8 months receiving solid or semi-solid food along with breast milk. That is increased from 45.9% to 59.5%. So these overall indicators indicating the increase in total nutritional value for the children's and proper health growth and progress is visible in this data. Now, next comes the women's empowerment and financial inclusion. So, women, we left one point, that is health protection expansion, that is coverage under the insurance. It increased from 41% to 60.2% in the recent data. Now comes the data about women empowerment. So women who had ever used internet, it nearly doubled from 33.3% to 64.3%. And the women who have a bank account or a saving account that they use themselves is increased from 78.6% to 89%. And the women who uses mobile phones is increasing from 53.9% to 63.6%. The use of hygienic methods, that is access to the hygienic methods of sanitary products, is increased from 77.6% to 79.2%. So this is all for the video. I know there are a lot of data that you can find on the internet and other websites also, but you cannot remember all the data. So read less and retain it for a longer period of time. So if you like the video, then hit the like button and subscribe the channel and share it with your friends also. And if you have any suggestions, mention the same in the comment section. Thank you for watching.